Well, White House COVID-19 officials warn the next few weeks will be challenging. This as schools and businesses and hospitals try to cope with a rapidly spreading new variant of the coronavirus. The Fox Medical Team's Beth Galvin has more.
The head of the CDC says the U.S. is now averaging nearly 500,000 new COVID-19 infections a day, up 98% from this time last week. And here in the metro Atlanta area, hospitals say they are feeling the impact of Omicron. Children's Healthcare of Atlanta had 118 kids hospitalized with COVID-19 Wednesday, up from 102 Monday, and the pediatric system's highest number of coronavirus patients so far in the pandemic. A spokeswoman says 74% of the children hospitalized have at least one pre-existing medical condition, and with 3 hospitals, Children's has enough capacity to continue seeing and treating patients. CDC Director Dr. Rochelle Walensky says the jump in cases is part of a national trend.
Over the last several weeks and over the holidays, we have seen a significant and rapid increase in COVID-19 cases. This increase reflects both cases caused by the Delta variant and, more importantly now, cases surging from the Omicron variant.
The CDC projects the Omicron variant now makes up 95% of new COVID-19 infections in the U.S. And Dr. Anthony Fauci says the good news is Omicron, which is thought to be at least 3 times more contagious than the highly transmissible Delta variant, does not seem to be making people as sick as the previous variant.
But the sheer volume of infections, because of its profound transmissibility, mean that many more children will get infected, and as many more children will get infected, a certain proportion of them, usually children that have underlying comorbidities, are going to wind up in the hospital. That is just an inevitability.
Teenagers 12 to 15 could begin getting booster shots as soon as Thursday once the CDC signs off on expanding boosters. Right now, children 5 and up are eligible to receive the Pfizer-BioNTech COVID-19 vaccine, but younger children 5 and under are not yet able to get vaccinated, and Dr. Fauci says he knows parents are concerned.
One of the best ways to prevent infection in children who are not able to be vaccinated because of their age is to surround the children with people who are vaccinated and to do the important things of when they are out, make sure that if they're old enough to be able to tolerate a mask, put a mask on them, particularly in congregate settings.
Dr. Fauci says the clinical trials for a vaccine for very young children are ongoing, but we will likely not have enough data to make a decision on that vaccine for a few more months. For your Fox Medical Team, I'm Beth Galvin.